Malformations of brain. Most cerebral vascular malformations are congenital lesions and represent morphogenetic errors affecting arteries, capillaries, veins, or a combination of these elements. Development of human fetal vascular system occurs via two related processes, vasculogenesis and angiogenesis. They are classified histopathologically and functionally into various categories based on presence of arteriovenous shunting or without arteriovenous shunting. Our aim is to describe MRI findings of various brain vascular malformations that aid in diagnosis and planning management. Retrospective cross-sectional evaluation of MRI features in 7 patients with brain vascular malformation was done in Department of Radio Diagnosis in Dr. Deepak Patkar Medical College, Pune, during January 2024 to October 2024. MRI brain was done for patients on Siemens 1.5 Tesla machine with contrast and angiography sequences and other specific sequences as and when seemed appropriate. 7 cases were followed and segregated according to the MR findings into various arteriovenous malformations and other vascular malformations. The first case is of a 59-year-old gentleman who presented with complaints of headache. Figure A and B shows multiple flow voids on T2 and flare sequences in the left parieto-occipital region with dilated cortical veins along cortex. A nidus is seen containing gliotic vein parenchyma. We can appreciate moving on gradient image in figure C. MR angio sequences reveal branches of posterior communicating artery communicating with the nidus. Contrast venous sequence showed a nidus in the parieto-occipital region with shunting between branches of posterior cerebral artery and cortical veins. Spetzler-Martin grade 2 AVM was diagnosed. The next case is of a 37-year-old lady who presented with complaints of headache and giddiness. Figure A and B revealed multiple flow voids on T2 flare sequences in the right parietal region with dilated cortical veins along cortex. Nidus is noted containing gliotic vein parenchyma. Blooming can be appreciated on gradient images in figure C. On MR angio sequences, branches of a middle cerebral artery are seen communicating with the nidus and early draining cortical veins. Contrast venous sequences showed nidus in the parietal region with shunting between the branches of MCA and the cortical vein. Spetzler-Martin, grade 1 arteriovenous malformation was diagnosed. We have a case of a 50-year-old gentleman who presented with complaints of headache and giddiness. Their A and B revealed area of altered signal intensity in the left occipital lobe with multiple flow voids on T2 and flare sequences. Extensive prominent tortuous dural varicosities were noted predominantly near the left transverse sinus. Moving on gradient images were seen. MR venography sequences showed numerous extensive prominent tortuous dural varicosities near the left transverse sinus. Dural AV fistula was diagnosed. A 37-year-old lady presented with headache. Figure A and B revealed an asymmetrically dilated tortuous left superior ophthalmic vein and dilated left half of cavernous sinus with T2 flow voids within. Large, partly thrombosed aneurysm was noted in cavernous segment of left ICA, which is bulging along medial and lateral margin of left cavernous sinus. High flow communication between intracavernous portion of left ICA and left cavernous sinus is also noted. Heretico cavernous fistula direct Barrow's type A was diagnosed. Next, we have a case of 40-year-old female presented with giddiness and imbalance while walking. Area iso-intense on T1 weighted, hyper-intense on T2 flare, with no diffusion restriction or blooming on gradient sequences were noted. T1 contrast with the study revealed subtle enhancement with medusa head appearance of prominent medullary vein converging in transcortical collector veins. Developmental venous anomaly with hemosiderin deposition was diagnosed. This is the MRI brain images showing inhomogeneous signal loss on T1 weighted and T2 weighted images with serpentine flow voids of dilated fibers. Signal misinterpretation on phase and SWI sequences with thrombus of varying age was noted in the periphery. MR angiogram revealed dilated feeding vessels entering the aneurysmal malformation. Vein of Galen aneurysmal malformation, neural type, was diagnosed. Area of signal abnormality in the anterior aspect of the bones, slightly hyperintense on T2 weighted and iso-intense on T1 weighted. SWI sequences revealed blooming. T1 contrast sequence showed ill-defined, mildly enhancing lesion. Capillary telangiectasia of bones was diagnosed. In conclusion, 7 cases were followed and segregated according to the MR findings. Among them, 2 were arteriovenous malformation. 1 was AV fistula, 1 case each of developmental venous anomalies, capillary telangiectasia, vein of Galen malformation. Different imaging features based on sequences like T1, T2 flare were seen. Also, gradient sequence like hemophase, SWI were taken into consideration. MR angiography or venography were followed whenever seen appropriate. AV malformation were characterized according to Spetzler-Martin scale. Corticocavernous fistula were assessed according to Barrow's classification. Cases and imaging characteristics of dural AV fistula, developmental venous anomaly, vein of Galen malformation, capillary telangiectasia,